video, I will be discussing a case of polycystic ovary syndrome. I'm going to go over the signs and symptoms, causes, treatments, and complications that may come with this disorder. In this case, the patient came in with complaints of excessive, new, and unwanted hair growth on her face, weight gain, acne, irregular and lack of periods, fatigue, and changes in her mood. Doctors ordered blood tests to check hormone levels, as well as an ultrasound to examine ovaries and the uterine lining to look for thicker than normal uterine walls, as well as cyst. When blood work comes back, it is observed that testosterone levels are elevated. The ultrasounds reveal an abnormally thick uterine lining with multiple cysts. These correlate as the high testosterone levels cause the female body to not be able to have a normal menstrual cycle, where less or lack of a period results in a thicker than normal uterine lining due to less or no shedding. Doctors tell the patient that she likely has polycystic ovary syndrome and inform her that this is a very common disorder that can be very manageable with treatment and support. Polycystic ovary syndrome is a very common hormonal disorder that affects the ovaries in women, usually during childbearing years. This results in a thick uterine lining and thick cystic tissue on the ovaries that can result in infertility and menstruation problems. This disorder can also be linked to other health-related problems that are heavily related to your hormones. Polycystic ovary syndrome can oftentimes go unnoticed. Some signs and symptoms can be more severe in overweight or obese females. Some common symptoms are irregular periods, weight gain, fatigue, unwanted hair growth, thinning hair on the head, acne, mood changes, sleep problems, infertility, and depression. Note that it is extremely important that you see your healthcare provider or gynecologist if you are experiencing any of these symptoms. While there is no definite known cause of polycystic ovary syndrome, there are some things that may factor into this. Excessive insulin may increase androgen production and cause difficulty or lack of ovulation. Inflammation can lead to heart and blood vessel problems. And some research has shown that certain genes may be linked to polycystic ovary syndrome, and this could be hereditary. Excess androgens are also the root cause of acne issues that come with polycystic ovary syndrome. Some complications that can be linked to this disorder are an increased risk of endometrial cancer, lack of or irregular periods, infertility, obesity, high blood pressure, heart problems, diabetes, and a possible increased risk of breast cancer. Polycystic ovary syndrome cannot be cured, but it is highly manageable with treatment and support. Birth control pills can be a highly effective option. These pills do a great job regulating menstrual cycles and reducing male hormones such as testosterone. Combination birth control pills with both progestin and estrogen work best to decrease ovarian cyst as well as decrease the male hormone that contributes to polycystic ovary syndrome. Anti-androgen medications can also be used to bring down androgen levels, helping with excessive hair growth and acne. Fertility drugs can help with ovulation. Some surgical procedures can be done to destroy abnormal ovarian tissue and help bring back normal ovarian function. This disorder is not preventable, but with early intervention and treatment can be extremely manageable. It is also a very common disorder.